Before taking Jynarque 45 mg (am/15 p.m.) tablets, always read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually 2 times a day. It's best to take it once when you wake up and once 8 hours later. Always have water ready to drink while taking this medication to prevent dehydration. Drink water when you are thirsty and throughout the day and night if awake. If you experience vomiting, diarrhea, or cannot drink enough water for any reason, stop taking this medication and tell your doctor right away. The dosage is based on your medical condition and response to treatment, and your doctor may direct you to start at a low dose and gradually increase. Use this medication regularly to get the most benefit from it, and take it at the same times each day to help you remember. Avoid eating grapefruit or drinking grapefruit juice while using this medication, as it can increase the chance of side effects. Increased urination and thirst are common side effects of Jynarque 45 mg (am/15 p.m.) tablets antidiuretic hormone antagonists. You may also experience dry mouth, loss of appetite, or upset stomach. If any of these effects bother you, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Dehydration can occur, especially if you have vomiting or diarrhea that doesn't stop, and you cannot drink normally. If you notice any symptoms of dehydration, such as fast heartbeat or dizziness/lightheadedness, tell your doctor right away. Although a very serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects not listed, contact your doctor or pharmacist. Before taking Jynarque 45 mg (am/15 p.m.) tablets, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, particularly if you have liver disease, gout, or any issues with urination or sodium levels in the blood. While taking this medication, it's essential to stay hydrated by drinking plenty of fluids. If you have difficulty drinking normally or recognizing when you're thirsty, be sure to inform your doctor. This medication may also cause dizziness, especially if you're taking other medications for high blood pressure, so it's important to avoid alcohol and marijuana, which can increase dizziness. Jynarque may also affect blood sugar levels, potentially causing or worsening diabetes. If you have diabetes, be sure to monitor your blood sugar regularly and discuss the results with your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you're using. If you're pregnant, this medication should only be used if absolutely necessary, so be sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it's unclear whether this medication passes into breast milk. As always, it's important to consult your pharmacist or physician for any questions or concerns about using Jynarque 45 mg (am/15 p.m.) tablets. It's important to be aware that Jynarque 45 mg (am/15 p.m.) tablets antidiuretic hormone antagonists may interact with other medications, which could affect how it works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share this list with your doctor and pharmacist. Do not make any changes to your medication without your doctor's approval. One product that may interact with this drug is desmopressin. Additionally, other medications can affect how tolvaptan is removed from your body, which may impact its effectiveness. These medications include azole antifungals, cobicistat, HIV protease inhibitors, macrolide antibiotics, ribociclib, rifamycins, ritonavir, St. John's wort, and drugs used to treat seizures, among others. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much Jynarque and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. This medication should only be used by the person it was prescribed for. Sharing with others may cause harm. If you forget to take a dose, don't take it later. Just take your next dose at the usual time and in the amount prescribed. Don't take extra to make up for the missed dose. When storing Jynarque 45 mg (am/15 p.m.) tablets antidiuretic hormone antagonists, make sure to keep them at room temperature and away from light and moisture. It's important not to store them in the bathroom and to keep them out of reach of children and pets. If you no longer need the medication or it has expired, it's important to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Be sure to consult your pharmacist or local waste disposal company for the proper way to discard the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.